I'm hoping everyone can hear me now. Thanks for joining us on our briefing once I learned to use the mute and unmute button properly. This is Friday, April 10th, and we'll start our briefing with a few words from Charles McKee for a kind of an overview of the week.
Thank you, Matt. It's kind of hard to recall all the things that have happened in the week because they seem to change rapidly in a lot of different ways. I know that there's remains a lot of angst in the public and about the obviously with COVID-19 and novel coronavirus and how it may or may not be spreading through our community, and also what does it mean to be an essential worker and an essential business. The individual aspects of the essential worker, essential business is something that gets refined on a daily basis, mainly by Dr. Moreno and his staff, with a little bit of help from County Council. And it's a work in progress because obviously we haven't thought about every potential situation that might exist out there. And so I appreciate the flexibility of the community and the flexibility of the health department in trying to address and put into place the appropriate detail associated with what essential worker and essential business is. We want to encourage everyone to first look at our frequently asked questions page when they have a question about what is an essential worker or essential business, rather than just trying to inundate folks at the county who are trying to work on the front lines addressing issues. We recognize that there are going to be some gray areas, and we're going to try and work through those so that everybody gets the right information out there. There's been a lot of concern about different essential workers throughout the community, ag workers, grocery store workers, and others that we also share that concern and want to make sure that the message is getting out to those businesses so that they get the message to their workers and treat their workers in a way that protects them, so that we continue to have them on the front lines and have them helping us. Many of those workers, as I'm sure you're all aware, are some of the lower paid workers in our community, and we at this point want to make sure that we're treating them with respect and treating them well, and making sure that we're not unnecessarily exposing them to the novel coronavirus. With the overall issue of the spread of the novel coronavirus and the angst that may bring, and recognizing that the decisions that need to be made by the county should be driven by science and medical advice. We're looking at on Tuesday at the Board of Supervisors meeting to provide some additional information about what goes behind some of the decisions that we're making here locally. And so I would encourage everyone to pay attention to the board meeting on Tuesday, and so that you can get some additional information to push out to your viewers and readers about the science behind what goes into our decision-making process here at the county. And we're gonna hopefully provide some additional information on that Tuesday that will be helpful to the community overall. With that, I want to thank the various participants that are here today. We have mainly the medical community. We've had Dr. Moreno on a lot for these calls, and we've in and out. We've had Dr. Gray and Dr. Walsh from Natividad Medical Center, and also today I'm really happy to have Dr. Alan Radner from Salinas Valley Memorial to give some perspectives that he sees in the care of COVID-19 patients and preparations for the future. I think he gives a perspective that is calm reassurance that that we need at this time, but also recognizing the strain that could come onto our healthcare system, and hoping we can get some good comments from Dr. Radner on that. With that, Maya, I'm open for questions after you go through the presentations by everybody, and we'll move forward.
Thank you, Charles. First, let's start with Dr. Ed Moreno, maybe an update from our public health.
All right, thank you, Maya. So Ed Moreno, health officer, and Just want to thank everyone for joining us today. As far as COVID-19, I just want to thank Mr. McKee for stressing the importance of staying home and only going out for essential services. So that's really still very, very important. The best way to prevent the spread of, slow down the spread of COVID-19. We continue to update in terms of cases, we continue to update our website with information as it's made available to us and as it meets our thresholds for populating different groups, subgroups within our community. So latest number is of confirmed cases is 71 with 3 fatalities. And as time goes on and we start, our communicable disease team starts to release patients from isolation, the number of recovered will continue to go up. And again, I encourage folks to check that daily because we are updating it daily. And we're also updating the number of tests that are being done here and results that are sent to us here in the health department. And that's also on our website. In terms of contact investigations, we are still following up with every individual who's confirmed to have COVID-19. We are contacting them and working with them to make sure they understand how important it is that they isolate themselves at home, and also working with them to identify who they may have exposed while they were infectious, and getting a hold of those individuals and making sure they understand the importance of staying in quarantine and monitoring themselves for symptoms, making sure they understand how long they have to be in quarantine and what to do if they develop symptoms, which could be a sign of COVID-19 infection. And we have we're still working also with any employer, any agency, any organization that might have had exposures in their facilities. We still work with those individual organizations to make sure that we are identifying as many people as possible that may have been exposed. And we appreciate all of their cooperation in trying to prevent further spread in their facilities. As far as lab capability, we continue to, in the public health laboratory, continue to use the CDC, Centers for Disease Control and Prevention, provided test kits for testing. Hospitals continue to test, or excuse me, continue to collect specimens from the patients. And then the swabs are sent to us and we run them, and we're reporting out back to the hospitals either late the same day or early the next morning, the results, which is important for them to isolate who needs to be isolated, release from isolation, anyone that tests negative. And that's important so that they can preserve their the personal protective equipment resources that they have. At this time, also I had mentioned in the past that we're anticipating that hospital laboratories will be have put in orders to receive test kits to run tests. And I'm happy to say we're making some progress on that. California Department of Public Health sent to or decided that Salinas Valley Memorial Hospital should receive one of the Abbott machines to run PCR tests. These tests are, and we received that equipment today, and the SVMH is picking it up today and be taking it back to the laboratory. So this is the machine that can run the PCR test. It can run a test every 15 to 30 minutes. And but what we're waiting for are the cartridges, which are used to actually insert the specimens into the machine for the machine to test for COVID-19. So our lab director, Dr. Donna Ferguson, has submitted requests to CDC and submitted a separate request to FEMA for the cartridges for Salinas Valley Memorial Hospital. And SVMH has also ordered test kits through their Abbott representatives. So The intention is to provide, California Department of Public Health's intention is to add capacity for testing in a local hospital that serves a low-income population, and SVMH meets that criterion, so CDPH chose to give them the machine. We're hoping that we get the cartridges soon, and then that'll be what SVMH needs to start running tests in our own hospital. The benefit to that is that SVMH would no longer will be more self-sufficient in that they could continue to send tests to specimens to our laboratory, but they could prioritize testing for their own in their own facilities. So they would not have to send it to us, which means the time that takes to transport is removed, and then they can test immediately in their facility, and they can make quicker decisions as to who has COVID-19 and make decisions on isolation. And it'll also help them preserve more of their PPE, so they can use less PPE because people are in isolation for shorter periods of time. The California Department of Public Health also requires that the machine be available to do testing for priority contact investigations. So in the event that our public health laboratory is conducting a lot of tests and on a contact investigation, and we need some assistance for rapid turnaround, this machine could also be used for that purpose as well. The other update I have is that today I'll be issuing another health officer order. This is a health officer order that requires the laboratories that collect specimens from patients in Monterey County to report test results to me. Currently, the commercial and hospital and government laboratories are complying with state reporting laws and have been reporting to me, but this order just is a means of assuring that the laboratories will continue to report test results to the health officer as required by state law. It also, being a health officer order, also gives me additional authority to enforce laboratory reporting laws. This won't impact individuals' ability to receive test results from the provider who ordered the test. And as a reminder, patients who get tested should still call their provider for the test results. Just as also another reminder that information that's shared from healthcare providers to the laboratories and from the laboratories to public health are necessary to keep track of the patients and the specimens, to make sure that the specimen and the test result and the patient are kept in line, and there's no confusion or misassigning of test results to patients. So it's really important that that information continue to be sent from healthcare providers to the laboratories and to public health. We also use some of that information to identify who's at greater risk of getting infected and who's at greater risk of having complications. So it really helps to have that information for public health purposes to identify, to monitor the health of our community here in Monterey County. And,
Thank you, Doc.
and the health officer order will remain in place with no end date. I'll continue to monitor COVID-19 testing and reassess the need to continue or amend the order. So thank you, Mayor.
Thank you, Dr. Moreno. And then we're very pleased to have Dr. Alan Radner from Salinas Valley Memorial Healthcare System with us today to give us a look inside what's happening at this facility. Dr. Radner, thanks for joining us. Did we lose Dr. Radner?
I think Alan's still on. Dr. Radner's still on mute.
Can you hear me now?
I can. Thank
Hello?
you. Thank you for joining
Hello?
us. Yes, we can hear
Can
you.
you hear? Okay,
Yes.
great. Sorry.
Great. Thanks,
What I was
thanks for joining us.
You're welcome. Again, I don't have anything prepared specifically. I'm happy to answer questions. Again, just in general, I'd like to make a couple comments to echo what Dr. Moreno said. Today alone, I've been in 2 hours of meetings with all of the facilities. And I think it's just really important that people realize that this isn't just an individual Monterey County Health Department issue or an individual hospital issues. The hospitals, in kind of an unprecedented way with the health department, are all working together, trying to pull their resources, come up with ways to help our community collectively. And I think it's really been pretty phenomenal. And again, every day I'm in 2 to 3 hours of meetings with all of the facilities as we work to provide services for our communities. So I just wanted to echo what Dr. Moreno said and thank him for all the work we're doing together. The only question that might have come up is specifically to what Dr. Moreno just said, how to do with rapid testing. And, again, we kind of feel as though every day we're kind of chasing this kind of mirage of trying to get the things we need, like appropriate PPE equipment and rapid testing, and the ability and support. The county's done actually a phenomenal job in trying to be the test facility for all of the hospitals and do this in real time, which has dramatically enhanced our ability to take care of patients. And the ability for each of the institutions to also be able to test on site will radically change our ability to take care of patients. We admit many patients that we call a suspect, and it still takes us 12 to 24 hours to get those results back. And the amount of work and PPE and anxiety that goes on while we're waiting for test results is very difficult within each of our institutions. And to be able to get these results back within an hour or a short period of time is going to dramatically enhance our ability to take care of patients. So again, can't thank the health department enough for what they've been doing. And as we get some of these things in front of us, like more PPE and rapid testing, it's just going to make it much easier for us to take care of patients and be better prepared if and when there's a surge. So that's all I was going to say up front. But again, I'm happy to try to answer any questions.
Great. Thank you very much, Dr. Radner. And then we have Dr. Gary Gray from Natividad on the line. He can perhaps give us a brief update, and then we'll open it up for questions.
Sure. I really don't have too much to add today. We continue to, do testing. All of our testing is currently provided through the Monterey County Health Department. I think it's encouraging that CDPH has decided to place one of the Abbott testing platforms in Monterey County, and I think that will really benefit our patients and the community at large. Certainly agree with Dr. Radner. I think, under the lead of the health department, I think increasingly leadership from all the hospitals is collaborating and preparing for the future. And just like I think like every facility is currently doing, we're doing what we can to maximize our internal surge capacity based upon the likelihood that our numbers will increase. Though our current experience has been encouraging. But we still need to prepare, and I think it's been a great collaborative effort.
All right, thank you, Dr. Gray. And so that's from our presenters, and now I'd like to open it up for questions. You can either use the hand raise function, you can send questions by chat, or you can just ask questions the good old-fashioned way by asking them, and tell us who you'd like to ask your question of. So the floor is open. Any questions for any of our presenters?
Yeah, this is Paul. Hello, this is Paul Miller from the Pinecone. Can you hear me?
Yes, Paul, go ahead.
Just for Dr. Radner, could you elaborate a little bit on the Abbott platform and when and how you'll be putting it into use and how you will use it at SVMH?
Sure. So there's various methodologies to diagnose people with COVID-19, and the kind of classic methodology out there that people are using are what's called the RT-PCR, or reverse transcriptase PCR platform. The health department is using one of the more complicated, difficult, time-intensive, labor-intensive platforms, which is what the CDC has approved and has allocated historically. They've done a phenomenal job where they can do about 80 tests a day. And generally, unless there's a huge flow of tests, what happens is when we have a patient that comes to any of the tents, we send it to the health department and they run it. If we get it there early enough in the morning, we'll get that result back later in the day, and if otherwise we get it back the next day. And that's, again, there's places where it's a 13, 14-day turnaround, especially some of the commercial laboratories like LabCorp and Quest. There are 3 or 4 FDA-approved. They're proprietary. They're very similar to what's done at the health department, but they're rapid. They're run just slightly different, but it's basically the same methodology. And the Abbott one really has about a 15-minute turnaround. So this will just dramatically improve our ability. We have a patient down in the emergency department with pneumonia, and we can get the test back in 15 minutes, which is what we're able to do with influenza, for instance, and we know right away what we're dealing with. So it'll be tremendously important for all of the hospitals ultimately to have access to a rapid diagnostic test. For what it's worth, all of the hospitals actually have one of these platforms right now. We actually had already a couple of the Abbott analyzers. We had used that for influenza and for RSV. A couple of the other hospitals have. So there's a bunch of these in the community. The problem is, Dr. Moreno pointed out, it's not just having the platform, it's having the actual test kits or the material, the reagents, or the test kit that goes in, and we're all still waiting for those. So we're all sitting here just, with bated breath, waiting to get the test kits or to get the reagents, and there's multiple platforms already in the community. They're sitting there idle, and we really hope to be able to use those. So again, if we have additional Abbott analyzers and we have the cartridges or kits that go into that for the SARS-CoV-2 virus, it's going to just dramatically increase our ability to know what's going on much more rapidly and to triage and treat patients appropriately.
So all the hospitals have the machine and they use it for influenza and respiratory syncytial viruses. Are those both coronaviruses as well?
No, they're not, and all don't have the same machine. So
okay.
There's 4 or 5 FDA approved. We just happen to use the Abbott one historically. There's equivalent influenza and RSV tests that Trump and Natividad have, and they've also been FDA approved. That Gary can correct me. I think they have Qiagen at Natividad, and they're just waiting for the same kind of test kits. The Abbott one was sent to the state more recently, and it sounds like they're going to send it to us both because we have some previous experience with it and because we met the requirements that Gary has pointed out. But the other hospitals have analogous kits; they're just not the Abbott kits.
So is everyone going to be getting the reagent kits that are needed, or will those just be going to you? And what kind of timeline are we talking about on those? Do you know?
I have absolutely no idea. I didn't know we were getting the Abbott ones until today. Everyone's just sitting here waiting. I know Montage or Trump and Natividad are waiting as well. It's a different company. It's not the Abbott kit. And I think the minute they get those, they're going to be ecstatic. I don't have any insight when the other hospitals are going to be getting the kits as well. But anyone that gets it makes it better for everyone else because, it allows the health department, if we were able to be self-sufficient for a limited period of time until Natividad, for instance, got their kits, that would allow the health department to focus on the other hospitals that don't have them. So anything we get in the community, any hospital that has something helps everyone, basically.
And one more question for you while you're on the line. We heard from Dr. Moreno the other day about what he thought might happen in the county, but you are an infectious disease specialist, right?
That's correct, yeah.
So what do you think is going to happen in this county now? What's your most likely scenario for the amount of coronavirus? Well, I guess infections, first of all, we already have. And also, what kind of caseload do you think is realistic for seriously ill people at the hospitals in the, near future?
So I'm sorry, when you say what's the caseload that's realistic, you mean how many could we care for?
No, how many will you have to care for?
Who will we have?
How many will you have to care for? Yeah, because the numbers have bounced around all over the place and everybody's wondering what's going to happen next. We've heard about worst case scenarios, but we haven't heard about likely scenarios. So
this is completely my opinion, and I am as likely to be right or wrong as anybody else. I mean, I am an infectious disease specialist, but we've never quite had anything like this before. I'm cautiously optimistic that based on our population density, which isn't the same as these big East Coast hospitals or Midwestern cities, based on the early shelter in place, based on the work that's been done by the Monterey County Health Department and the Board of Supervisors, I think that I am optimistic that we aren't going to have the kind of surge that they've seen in the big East Coast cities. I think there are issues, though, that could really tax us. And, we do have extended care facilities, long-term care facilities in our institution, and one of those could have a problem, and that could tax the hospitals. There's prisons south of us. There's homeless populations. There's possibilities that even if we don't have big surges, that the governor could commandeer our beds and send patients down here. So I think we have to prepare for that. I'm, again, optimistic that we're not going to have the massive problems they've had in the East Coast just from the traditional residents of Monterey County, but these alternative, I think we're calling them special populations that are homeless or in other types of facilities could definitely stress our system. And I think there's a lot of work preparing for that.
All right, thank you. Thank you, Dr. Radner. Felix Cortez from KSBW was trying to ask a question. I'm going to give him a chance to ask his question again. See if is he on the line?
I think I figured this out. Can you hear me?
Yes, go ahead.
And this is also a question for Dr. Radner. Doctor, can you confirm that an employee at the Salinas Valley Prime Care has tested positive for the coronavirus?
Yeah, so I can say that the overwhelming majority of patients who've been found to be positive, I shouldn't say the overwhelming majority, a significant number of the patients have been seen in healthcare facilities throughout Monterey County. When we test somebody and find out that they're positive, they have been in either a provider's office or a clinic or somewhere in Monterey County. So it's not surprising that virtually all of the major medical clinics have had a patient. So we're not commenting on individual patients, but we feel in all of our clinics that they're safe and clean and there haven't been untoward exposures for any of the people who come into the clinics.
Thank you, Dr. Radner. And I have another question I think could be for both you and Dr. Gray regarding test kits. How long ago did the hospitals request the kits, and how many tests will be able to be conducted when the shipment of test kits arrive?
This is Gary. I can speak only for Natividad. So we do have a platform. It's different than the Abbott platform. We placed an initial order for cartridges or kits approximately 2.5, 3 weeks ago. The initial shipments that were produced, it's my understanding that they were sent to those areas of the country that were had the greatest number of cases at that particular time. Over the past couple of days, we have heard in general terms that we will receive an allocation. I cannot comment on their date of arrival or the actual number that will be allocated to Natividad. But I think, as mentioned by Dr. Radner, the ability to test our patients who are PUIs or patients who are under investigation and rule them in or rule them out in a more efficient manner would really help with patient flow and patient care.
Dr. Radner, are you still on the line?
Yes. Again, based on our previous platform, we thought we could test 40-ish patients a day. I'm not sure exactly what we're going to be ultimately getting from CDPH, and I'm not sure how many test kits we're going to be getting. So until I know that, I couldn't tell you how many we're actually going to be able to run. And I think we placed our order probably about the same time as Natividad did. Everyone, as these platforms were getting FDA approved, placed orders. Again, that order, we seem to be getting it through a non-traditional ordering platform. We're getting it through CDPH. So there's still just a lot of uncertainty as to what we're going to get and how many we can test. And again, we should know more in the next week.
And a question in by text that might be for all of you. What is the health department and hospitals doing to prioritize and test first responders and healthcare workers? And Dr. Radner, I know our time with you is limited. Would you like to go first on this one?
Sure. Well, we have out testing algorithms based on our limitations in test. We've already talked about the capacity right now. So there's algorithms in who we test, and people need to be symptomatic and have, at the moment, either very ill and symptomatic and have a likely exposure. We are facilitating the testing of healthcare workers because we think they're critical frontline people and they potentially had unrecognized exposure. So I can say that healthcare workers are being tested that day if they're symptomatic at all, whether they had or didn't have a recognized exposure. We just really want to try to keep them safe and keep them healthy and keep them providing care to our patients. We haven't been directly involved other than isolated cases in a policy with respect to EMS and other frontline workers. Maybe Dr. Moreno could speak to that.
So, yeah, I would just add that our health department has shared with all the laboratories and anyone that's testing criteria for submitting specimens to our laboratory. And we do prioritize healthcare workers and first responders for the reasons that Dr. Radner gave.
And Dr. Gray, do you want to add to that?
I don't think I really have anything to add other than I think like the other facilities, we certainly want to prioritize our frontline healthcare workers because they are, and we need to maintain our workforce.
All right, thank you, Dr. Gray. And then I've got a question in about alternative care sites. I've heard that if a homeless person recovers enough, they can be released, and that it's illegal to discharge them if they don't have a home to go to. Is that true? And if there's nobody on the line right now who can address this, we can certainly forward it to the appropriate department.
Well, I'll just chime in that we are working on alternative care sites, and there are different levels of preparation for alternative care sites. There's the potential for a surge that is overwhelming to the healthcare system, and there are also I wouldn't necessarily call it a care site, but the need to potentially house persons who have housing vulnerabilities after they might be potentially discharged from a hospital. So that if you have somebody who is currently experiencing homelessness, is tested positive for COVID-19, is at a hospital for care, no longer needs to be at a hospital, and we don't want them necessarily taking a hospital bed, what might be needed for someone else, that they're discharged, that we are working on places for them to recover separate from having to go back into the outdoor population where they might be living at the current time.
Thank you. Here's another question. I believe this is for Dr. Moreno. Do employees have any recourse if an employer forbids them to wear a mask while interacting with clients or customers?
I don't know that I can answer that question. All I can say is that California Department of Public Health has issued guidance on that, stating that any California could choose to cover their face, and if they chose to, they're doing it to protect other people that they're around. And so that's all I could say. I'm not sure I would have an answer for whether the person has a right to do that.
Thank you, Dr. Moreno. And if Dr. Radner, I think he's still on the line. If not, we can forward this question. You mentioned patients at Prime Care but the reporter would like to know if an employee tested positive at Salinas Prime Care. And we will go ahead and forward that question. We had a limited time with Dr. Radner today, and he may have had to drop off. So are there any other additional questions? Oh, Adriana, I see your hand is up. Please ask your question.
Yes, good morning. My question is, I've heard that the Latin community is at most risk of this virus. Is that true or not? Or what do we know about that? Thank you.
Dr. Moreno, perhaps?
Yeah, so as far as Monterey County goes, we still have, as we start dividing up the population of confirmed cases demographically, and we generate more boxes, those boxes start to fill up. Each of those boxes has small numbers, so the proportion of cases in Hispanic, Latinos, or white non-Hispanic or others will start to become more reliable. So what my epidemiologists, our epidemiologists are telling me is that the way things are trending right now early on demographically by race and ethnicity, that it appears that we're probably, COVID-19 is impacting different racial and ethnic groups in a distribution similar to the distribution of race ethnicity countywide. But we'll keep following that. And I think that is important because if there are some significant disparities, then I think that's something that our community should know as well. So thank you for the question, Adriana.
Thank you, Dr. Moreno.
Are there any other questions?
Maya, this is Mark Carbonaro from iHeart. I've got a question for Dr. Moreno.
Go ahead.
And that is actually, it's two questions. The first one is, and I'm sorry, I just got on the call now, but if we ran out of hospital beds in Monterey County, there was a surge, what's the alternate plan to being able to provide, more beds, more, maybe a field hospital or something like that? And where would you put it? And then secondly, I noted in today's Carmel Pinecone, there was a story about a Monterey Peninsula resident who has COVID-19, has been hospitalized at CHUMP and is being treated with it's tough for me to pronounce, hydroxychloroquine and some other drugs for patients at SVMH and Natividad. Do you know if they are using those same medicines or if they have other treatment methods for patients there with COVID-19?
Okay, so thank you. Is this Mark? Is that right?
Yes, that's correct.
Thank you, Mark, for the question. I could give a brief answer to the first question. And if Dr. Radner's still around, he might want to reply to the second question. So briefly, we are looking at modeling. This is still considered early modeling because we still have fairly low numbers compared to other parts of the country that have large numbers and their modeling more reliable. So we are looking at that, and it still looks like there's still a definite real possibility that we will run out of hospital beds when we reach our surge. And so the plans right now are first and foremost is for people to follow the stay-at-home order, the shelter-in-place order, because actions that we take today are going to impact the number of people who are sick at the same time at the peak. And that is why we have to follow the shelter-in-place order. While people are doing their part throughout Monterey County to minimize contact with other people, the hospitals in the county are looking at alternatives for isolation for people who are living in congregate living situations. So that would slow down the spread within homeless populations or within some of the shelters or the group homes. And in addition, there's plans there's still a planning process right now to look at how we might set up an alternative care site that has some level of care that can't be provided in the home, but could be provided in a site away from a hospital. So those are some of the activities that are still going on right now. And I I couldn't answer the second question. So if there's someone from the hospital still on the line, maybe they could answer the second question about the use of hydroxychloroquine.
Thank you.
Dr. Gray, are you still on the line? Would you want to venture an answer on that one?
If the question regarding whether the hospital is using Plaquenil or hydroxychloroquine, the answer would be yes, we have. Plaquenil's a drug that's been around for many, many years, and it's most commonly used for lupus and other medical issues. I cannot offer any particular advice regarding its efficacy or its overall impact on the course of a COVID-19 infection.
I can also chime in on the beginning of Mark's question, which I think was about alternative care sites. And just to let them know that we are actively working with the health department, the hospitals, and experts in setting up field hospitals and folks that understand the availability of resources in hospitals, resources that we might be able to obtain to find a suitable location for alternative care sites. So we are actively doing that, and we're looking at stuff today and probably tomorrow, and making sure that we have it all ready to go when if a surge happens. And we certainly hope, as Dr. Moreno and Dr. Radner and Dr. Gray have said, we hope it doesn't happen, and we hope that we are over prepared and overreacting. That's the goal, so that we don't have a system that gets overwhelmed. The goal is to be able to maintain, to care for our residents within the system that we have, and we have an excellent healthcare and hospital system here in Monterey County that has quite a bit of extra capacity at the moment. We don't want people to be complacent with that information, but they should know that there's some excellent staff, there are excellent doctors, nurses, healthcare professionals, and bed space available at our hospitals right now. But we will also be prepared if those the availability of hospital resources is exceeded.
Thank you, Charles. Are there any other questions for any of our participants?
This is Paul Miller. I have one more quick. Yeah, go ahead, Felix.
Oh, thank you, Paul. A question for Charles. This week, Salinas announced that they're ordering all full-time employees back to work Monday. Where does the county stand in terms of your employees being on paid admin leave, and when do you think you might be calling those employees back?
So I can't comment exactly on what Salinas has done. I didn't actually see the message, but the overwhelming majority of county employees are either working in their offices in a way that allows for distancing, or in facilities throughout the county, or working remotely. And we have, as you know, we have approximately 5,000 employees, and right now I think they're under 100 at the moment. That I think it's a little over 50 maybe who are not currently utilized in working remotely, or in working in the office, or working at another facility. But we are, at the same time, we've come up with a plan to utilize those workers to reassign them to other places throughout the county. Obviously, one of the key areas that we're looking at is the Emergency Operations Center, and any particular skills that people may have in assisting in that regard. I've also tapped into some people who had some expertise in translating from English to Spanish some of our communications where they weren't necessarily being fully utilized right now, as well as helping to work on things like our website to make sure that we have our information out there. So the percentage that I'm guessing it's well under 1% of our, but I didn't do the math. I'll ask one of the doctors to do that for me, of our staff that are not currently working because they can't work remotely, but we're going to try to put every one of them to use in different assignments throughout the county.
Thank you, Felix.
Thank you.
And then Paul, did you have a question?
Yeah, for Dr. Moreno, when you decide to issue, or for example, last week you tightened the shelter-in-place order, who gives you input about the economic impacts about the orders you issue? And do you take them into account, or are orders like that, let's take construction workers, for example, that you mentioned, are those done strictly from a health point of view, or do you consider the jobs and the economic ramifications when you issue something like that?
So as a health officer, if I issue orders, any order, it has to be the least restrictive possible to achieve the public health outcome that I'm trying to achieve. So the public health outcome I'm trying to achieve is to reduce the maximum number of patients who are going to get sick during the peak of this pandemic in Monterey County, which would reduce the number of people who die from COVID-19 in Monterey County. And that's what I'm trying to achieve. And so in order to achieve that, there is no less restrictive mechanism to achieve that other than shelter-in-place order and only leave your home for essential services. And if you do leave your home, maintain social distancing and wash your hands. So that is the least restrictive way of achieving that outcome. Again, it's because there is no treatment for COVID-19. There's no way to kill the virus, and there's no vaccine. So that is the criteria which I use. Health officer orders typically do cause some limitation to an individual's movement, access to services, and that's true of most health officer orders. So I do take it into account every time I write a health officer order. These aren't the first orders I've written. I do that. I check with county council to make sure that I'm not, in so doing, I'm not taking away violating someone's constitutional rights, and then I issue the orders. So, but that's a very good question. Thank you.
Thank you, Dr. Moreno. Are there any other questions for our participants? I have no more questions in through chat, and I have no questions via text. So if that's it, then thank you for joining us for our media briefing today. Our next briefing will be on Monday. Thanks for joining us.